subjective experience. What is it? Because it's ineffable. It's inexplicable. You cannot put it in human language. That's been a big thing among religionists and saints in religious literature. This is one big problem. When you want to discuss consciousness, it's called qualia, the subjective, the raw experience of the information that comes into our mind. How do we experience it? And the only way to know is to actually experience it yourself. That is why mystics say the example of their experience of union with God, or whatever you want to call it, or becoming one with the cosmic consciousness, or to experience God, they will say, this is something I cannot explain to you. It's only if you experience you will know what it is like. I cannot put it in language. So this is a challenge they have put forward always throughout the ages. It's a challenge for scientists. So that's problem number one. Now there is a bigger problem that religions have thrown at scientists, and that is, it's not only that subjective experience that I experience, but the fact that I know that it is me, it is I that is experiencing that experience. It's I. What is this I behind it? Who is this person that is conscious of, not only conscious of the fact that I have experienced, but I'm conscious of the fact that it is me, it is I that experience that thing. That is the core, that's the center of your mind, so to speak. That's the core of consciousness. That's at the that problem is the very heart of consciousness. Scientists have taken two approaches to explaining what those phenomena are. One is approach taken by Frank Watson and Crick. His name is Francis Crick. His approach is that this I that represents consciousness behind the raw experience, that there are neuronal correlates in the brain, that there are structures in the brain that correspond to each kind of consciousness, that you have to have those parts of the brain that correspond to each experience, and without those circuitries in the brain, which is separate for each experience, you cannot figure out. They really believe that. Francis and Christoph are trying to say, well, let's worry about the subjective experience. About it. That problem of I is too complex. We will deal with it later. Let's right now deal with what actually happens in the brain when you experience something, when you smell a rose. So they're studying the brain. There are two approaches. One is, I give you some kind of stimulus and we take pictures of your brain, put you in functional MRI and see what's going on, where the neuronal activities, where the electrical activity, which areas of the brain light up. When you make a decision, when you feel something, you feel pain, when you smell something, when you think of a thought, what happens in the brain? That is one approach which Christoph and Francis have taken. The other approach is taken traditionally by medical doctors, not medical doctors, basically those who specialize, neurologists and people, not even neurologists, people who do research. I mean, you have to do research. Just being a neurologist doesn't mean anything. You wouldn't know anything about it until what you do for a living. Dedicate your life to that. So this approach, generally taken by physicians who specialize in that, is by studying those people that have some kind of a damage to the brain. So these people walk in, someone has a bullet going through certain parts of the brain, someone was born with a genetic disease that certain part of the brain did not develop, looking at someone who is 3 years old and is a musical genius. There is someone who is 7 years old, he can do calculations faster than the supercomputer in the world. looking at if the nerve in your arm got cut, what happens. They are looking at damages to certain parts of the brain that respond to the loss of certain kind of consciousness, and found out that there are certain structures in the brain that correspond to certain experiences. So by constantly studying that, we are mapping the brain. Now it turns out that brain structure is mapped. This area deals with speech, this area deals with understanding, this area is the motor cortex. This moves your limbs, this moves your legs, this moves your genitalia, this increases the heart rate. So there is an area mapped for every function and every kind of awareness and consciousness. The damage occurs, yes, the brain can learn to rewire, but that's something that comes later. That's not what we are talking about. What they are trying to figure out is that certain parts of the brain deal with certain kinds of consciousness. And this is how they study it. And I'm going to give you some examples. Now these kind of examples can actually lead to practical advice where it's useful. There were two people that I saw had stroke. I had promised them that if they come, I will go over some techniques, how you can reverse the effects of this. If you have anyone in the family, let me show you how those techniques actually work. Is being used all over the world, because knowing, having that knowledge, how you can fool the brain, how you can use the brain to affect your environment, and how you can use your environment to inspire the brain or to fool the brain, whatever serves your purpose, it's possible based on what we learned in experiments. So I'm going to give just a few examples. And this approach has been remarkable and very useful actually, and very practical. I know the discussion today has put half of you to sleep. I understand that. But that's the nature of the animal. Hopefully you will like when the discussion lightens up in the third seminar, because now we are doing practical things. But I believe that without a proper understanding, knowledge is useless. When you do meditation, whatever that you do, it's a waste of your time. It will not do anything for you unless you have the understanding. That's the difference between knowledge and understanding. I always talk about knowledge won't do anything unless we have a sense of appreciation of who we are and how our body and mind, our consciousness works. That is why I have to torture you for 2 seminars before we get into the actual practical easy stuff. This is the torture chamber. So let's look at some examples. Give you an example. There is a small piece of tissue, so to speak, right underneath the temporal lobe, and it's called fusiform gyrus. A lot of things in the brain are called gyrus. Gyrus is, convoluted areas are called, because that's what the brain looks like. It's a small gyrus. It is known for a while that fusiform gyrus is area of the brain that recognizes faces. If someone is born with a genetic defect, that there is a damage to that area, or that area did not develop, something very funny happens. Or this can happen a damage later on. Let's say you have an accident and there was a spear in that part of the brain, damaged the blood supply, so that area does not work. Now you cannot recognize faces. These people, they don't recognize their friends, their mother, father. It's like an Alzheimer's patient. Remember the difference between Alzheimer's. Do not compare the both, because we are talking about 2 different situations now. These people are perfectly lucid, intelligent, they can be professors, anything, very accomplished people. There's only one missing part of the consciousness. They just do not recognize faces. Look at their mother, just like Alzheimer's patient, they look at their mother, their children, friends, all of a sudden, I don't know who you are. They look at, like they're looking at a stranger. So you see how this begins to give you ideas about the practical. advice, like understanding of what the brain is doing, and once we understand, we can exploit that to our advantage. Now I'll give you an example. There is a syndrome, it's called Capgras delusion, and this is very well described by Ramachandran. He gets a lot of credit for doing this kind of research. And that delusion is that all of a sudden there's a brain injury and this person comes home and recognize his or her mother, insist on saying that you are an imposter. You are my mother, you look like my mother, but you are an imposter. Be my mother. That's very strange. Now again, this is a person we are talking about, perfectly lucid, intelligent. There is absolutely nothing wrong with this person other than the fact that he has lost awareness, because we are talking about consciousness awareness, how brain will take away the consciousness from you, certain kinds of consciousness, depending on what happened to the brain. So there is a correlation. This is the kind of research we are looking at now. What happened in this person? So when they map the brain and they're doing research, something very interesting. Why does he recognize the mother? Not recognize the mother, but he at least recognized that you look like my mother. But you're an imposter. You can't be my mother though. You look like my mother. Why he insists on that? Because the cables, so to speak, or the neurons that connect the fusiform gyrus intact. So he recognized the face. See the difference between the first example and this example? Now this time fusiform gyrus is not damaged. If it was damaged, you will not recognize any face. So you don't know who are these people looking at. I don't recognize anybody. But now the fusiform gyrus is intact, so you recognize the faces, but you are now telling your friends, your mother, your children, your dog, your teddy, little teddy, okay, he's an imposter, looks like my teddy, but he's an imposter. Because in this case, the fusiform gyrus is intact, but the neurons that go connect to the fusiform gyrus with the amygdala is somehow severed. They got cut off. Therefore, there's no message going from fusiform gyrus to the emotional part of the brain, which tells your that this is not only look like your mother, but actually this is your mother, because the emotional aspect of the brain, which is going to emotional significance. Now, they have studied amygdala for a long time, and what it does is you can show a person this chair or table or rug or something, and then measure the sweat on your emotional response, galvanic response. There are many machines they can hook you up to. Because when you have emotional response or arousal to something, you will sweat. Your temperature will change. They can measure all those things because it's so microscopic, you can't obviously tell if you're having arousal. But with the machines, you can tell. So if you show a chair or a table, there's no arousal, there's no response. You show something that related to you or any emotional, you'll see arousal. This is how the emotional brain works. This is how the machines will detect that there's emotional response. Now, recognize the face. When there's no message going to amygdala, you ask yourself, you know, she looks like my mother, but why is it that I'm not having any feelings? Your brain tells you, so she must be an imposter. So this is how this syndrome develops. It's been known for a while. There are studies done on phantom arm. You know, people went to Iraq, in war, they lost their arm. They lost their arm, they lost their leg, and the soldier comes home and going to the hospital over and over, back again, and he says, you know why, I feel my foot. I feel my foot, you know, it's kind of funny, I look under my knee, there's no leg left, but I feel my foot, I feel my toes. That is called phantom limb. Your brain still thinks there are messages coming from the foot, that the foot is still there. How we are going to manipulate and use our mind to change our bodies and change everything about health. A patient is complaining that, you know what, my arm which is missing, the arm is missing, that it's hurting, my